Yes, good morning,
Anybody,
doctor.
can you hear
Yes,
me?
good morning, doctor.
Okay, good. Is it my voice clear?
Yes, doctor.
Okay, perfect. So so good morning everyone. So today is my turn. So let me share the screen. So I hope you guys are well and awake because it's an early morning for me as well. So all right. So today we're going to cover the another topic, which is professional training and certification. So right. So we're going to cover a few things today. Uh, a few definitions, and we're going to cover ethical issues in trainings that involve the professionals, and a bit touch on the credential issues, and then we're going deep down on maintaining personal competence, which is one of the ethical issues that involve in the professional training. And I put up a term called the impact practitioner, which is we're going to do some discussion on it. So, okay. All right. To kick the today's lecture, can you go to www.menti.com and just use that code 8763950. All right. Let me do this the same. You're going to have the question for you today, a very easy question, the early wee morning. How do you feel today? And put up 3 words. I hope everyone can join us. Those who are just joining, just go to www.menti.com and then use that code 8763950, and then let's see what's your response. So keep, let's see the share screen. So I can see that most of you are happy today. Oh, someone is happy anniversary. Wow. You want nasi lemak. You're going to feel very sleepy soon. Hungry. Why don't you take something to eat? Some people still sleepy. Why you have to be anxious? This is just my lecture. It's not Prof. Jaffrey's lecture. Um, right. Energetic. Well done. Tired. What happened? You worked too a lot yesterday, is it? Stress. Jeez. Bless. Okay, I saw the big. Actually, this word thing is when you see that the bigger the word is, that most people respond to it. So I can see the blue one is a big chunk in front of my eyes in the center is hungry. Go grab something while listening to me talking today. So feel like having coffee, good, motivated, right? Hungry. Most of you are very hungry. So maybe grab something. Otherwise, it's today's lecture is more into exploring the discussion part. It's not like a lecture, like a lecture. It's more into the discussion, and you have a lot of you know interaction with me and like giving a response and things. Going to meet Lauren. I don't know who is the Lauren. Um, well, happy, good, hungry. Hungry is most of the word that from your group. Okay, it seems that most of you already respond. Well done. Homesick. Now, well, curious, peaceful, tired. This is the way. So, okay, guys. So I see this is just the activity. I want to see your mood this morning. So most of us like hungry. Just get something like I said. Awake now. Quite busy. I know that. I tried not to giving you the assignment because I know that most of the lecturers giving you an assignment, and I heard that some of you have to do. Hello, did I hear something saying? So
No,
most of
no,
you
I said
have
thank you
to.
for not giving assignment.
Sorry.
I'm saying thank you for not giving assignment.
Okay. Yeah. I never give assignment to the student unless I need to. So it just the activity. My mind is coming from your contribution in the class, and that's it. And I understand because I was a student before, so I hate assignments because it's consume a lot of my time. And man, that's it. That's it. And all right, so let's start. So I hope you can contribute to the lecture today. I'm going to give you some activity. All right, so let's stop this sharing. Share. Okay. Right, thank you for contribute. I'm going to find marks for you to get as long as you put something on it on the assignment, not assignment, the contribution to the class. So, all right. So exploring today's topic, which is more into professional training and certification issues. So we're going to explore a few bits of the element of the discussion. Is more into discussion, I say. So I love every time when I giving you a topic, then we're going to recap every time. So the last topic is into the academic setting, things like that. I forgot the full topic, but we're going to do a recap. What have you learned previous class with me, and then and this topic we're going to do some introduce you some few important vocabulary and definitions, and we're going to discuss exploring the issues of ethical in training and certification. And I might be touch a bit of the gaining the credential. What is the ethical issues of gaining the credentials? And credential is one of the vocab that probably you should know later on when you're taking up the class. So we're going to discuss a few issues in maintaining personal competence, which is very important in professional training and certification issues. And I put up the term called the impact practitioner. So you're going to know about this later. The impact means it's not function well, and so this is the impact practitioners. So like I told you, the assignment is not coming up from me. That I'm sure about that. So we're going to do a discussion, and I need that everyone needs to get involved in this. Recap on this is clinical practice. That's the topic. Clinical practice in academic service. This is the last one, the last lecture with me. So you cover the challenging, what the issues in the clinical practice, academic and service last time, and we discussed about mental health professional in academia, and you wrote the assignment that on the class confidentiality, privacy, and record keeping, and we discuss about ethical issues on relationship with colleagues, supervisors, student, and employee as well. And we touch a bit on psychological assessment and challenging work with human diversity setting. So another recap slide from me last time. we learn about the element of ethics. So you have choice, value, roles, control, and power. This is just to recap, all right? So, and then we touch about common pattern of unethical behavior. You have three common patterns that I lay out here with the example of case scenario. Remember that? So we have competition issues. We have a lack of maintaining self-awareness. And we also have one of the common pattern of unethical behavior is insensitivity. You cover that with the case scenario. I'm not sure whether you got the lecture notes or not on this topic. I promised to you that to give you a lecture note. I'm not sure. Double check with me again whether I gave you this or not. And this is just a summary of the relationship. We also cover with relationship with colleague, supervisor, student, and employee. I summarize them into four ethics in relationship between four groups. You have the first group, interprofessional and peer relationship. And you have the second one is clinical supervisor relationship and providing references and sexual harassment. So each one, I provide the case scenario, which is makes you more to understand the situation what we're discussing. So we also cover the definition towards the end of the lecture. We talk about privacy, what is a privacy, what is a confidentiality, and what is a privilege, and give a few bit of examples. And then I think let's not digress anymore. We just go straight to the lectures today. We're going to cover a few definitions of the professional training and certification issues. And we discuss about a bit of a training issues, the ethical that involve in training issues, credential issues, and mentoring personal competence and the impact practitioners again. So, right. So when we talk about the definitions, I would like to introduce you about the term called intellectual competence, emotional competence, and credential. So you should be able to differentiate between these terms, and possibly if I would like to ask you in the exam, what is this term? You can not specific to my lecture. From what you understand. So any terms that you understand with this meaning, it will be great. It not like, for example, I giving you an example of how I understand about intellectual competence. Intellectual competence refer to acquisition of knowledge based on empirical research and sound clinical scholarship regarding practice with particular client population. And this definition is more into your psychology or cognitive uh, field. So you can define as long as it fall into these definitions. So I every time when I ask you, for example, if I'm willing to ask you about the definition of certain vocabulary, you have to give an example. Uh, so it's much more better, or any of the lecturer, if they ask you in the exam, is much more better if you give them the example. So intellectual competence, the example is ability to assess, conceptualize, and plan appropriate treatment for particular client or problem. So the next one is emotional competence. What do I mean by emotional competence? It refers to the ability to emotionally contain and tolerate the clinical material that emerge in treatment, and their willingness and skill at detecting the intrusion of the personal bias into their work. For example, capacity of self-care in difficult work in psychotherapy. So this is like a general and specific definition. So you can write any of the definition here, but as long as you give the example, it will be great. All right? And then we go to the next one. What is a credential? Credential, it refers to qualification, achievement, quality, or aspect of the person's background, especially when used to indicate their suitability for something. So credential is like for example, DSW is degree of social work. So we know that if if certain issues that you need the certain credentials, so you need the degree of social work, so something like that. So that's how I define the credentials. So these are three important definitions. You have to know, at least to understand the meaning of it, not just to remember this. So okay, next one. We move to the after the definition. We move to the training issues. What are um, the ethical issues that involved in the training, professional training and certification issues? So sometimes we question ourselves how I plan for my education, what you want to be, and that's why you go for these courses. I hope so that one of your career plan. And then you question, sometimes you say, I wish to become the human service provider. And then you question sometime about how behavior scientists, physician, or train as a mental health professional to undertake retraining, because sometimes you are trained as a psychologist, you want to be the because of the career path, you want to change it and you want to reuse again. So how are you going to do that? What are the issues behind this? And then are practitioner adequately trained for the job that intended to perform, which is much more relevant to you. Some of you are part-time job. You're taking this because some of them are required from the job. So some of them is just personal satisfaction. So and some question about are these techniques used to train them ethically defensible? And are students evaluated in an ethically appropriate manner? So some of these questions I just raised. So for example, training issues could be competence by degree. So for example, if you have certain degree, is it competent enough? So question about that. So I put here entry level practice. If you want to do a medicine or in psychology, is you have to be a medicine or law. I put an entry level of practice psychology, and you have PhD, you have a doctorate in education, PsyD, MA, and MS degree, and this you can practice in psychology. So what else? So you have a certain degree, like have a certificate of advanced graduate studies, CAGS, and most of these is available in United States because they are very. I know that certain courses of psychology is very competitive in United States, so they have a several qualification. For example, Doctor of Science, Educational Specialist, DMH, Doctor of Mental Health. Doctor of Theology, Doctor of Ministry, Master of Education, Master of Science in Social Service. So this is already have accredited in United States. I'm not sure the current. I have to be honest with you. I'm not sure about the Malaysian kind of list of the certified degree in your field. Because I'm not really in the psychology path. I diverted into the fundamental neuroscience. I'm studying. I have a background of stem cells in clinical spinal cord injury. So I'm sorry about that. I cannot comment much about the degree in psychology, that which one in Malaysia that is that is available for you or to discuss. I'm sorry about that. So another thing, that there is issues about PsyD and PhD, whether I hope this. Yeah, we still have it. In social work. One may qualify for varying level of licenses with BSW, which is Bachelor of Social Work, Master in Social Work, or Doctorate in Social Work, or PhD. Some program also grant MSSS, Counselor Education Program may offer MA, MD, Master of Education, or Doctorate in Education, or PhD degree. They also have a marriage and family therapy program and also offer MA, MS, and PhD degree as well. So this is more related to medical doctors. Yeah, so doctorate degree has been well established as the entry level practice credential in psychology. So I think what they mean by this is as long as you got the PhD, then you have the entry level of practice credential in psychology. That's what Fox, Robina, and Ed Wall say. But this is the long time ago. It's 1994. And then I quote on the same person, Robina said, an examination of the course content, curriculum, and duration also substantiates that master's and doctorate training in psychology are not equivalent. So there is a issues about these things. It's already raised by certain people a long time ago. For example, mental health, counseling, marriage and family therapy, social work, advanced practice nursing. So PsyD degree first began in response to perceived need to offer specialized doctorate training for practitioners not seeking research career. So you don't need to do if some job not require a high level of credential or training issues. You just if you want to a certain job, there may be enough for you to have a master's degree. And if you want to take up the academic post in most of the university, mostly in Malaysia now, probably you need to have a PhD, and to practice a certain degree, you have to have PsyD. So that's what I understand from this. Many professions that once considered the master degree as a top clinical practice, that what I told you, credential in their field have begun to imitate the PsyD degree already. So if you enter the master degree, that very competitive in the country. So sometime and bear in mind this is issues only in United States. I'm not sure about the current issue in Malaysia. Do they question about if you want to do this, you have to do a certain level of training? I know that certain if you have a certain education like a master's degree, but you have a lot of a training credential already, so maybe you can do something bigger. I don't know. I'm sorry about that because I cannot complain much about that. So physical therapy has encouraged a move from the master degree to the doctor of physical therapy degree. Then you can practice. So we move to another one. I'm sure that's quite a very heavy topic for me as well to discuss about training issues. I don't want to put something that I don't know much on it. Like for example, the training issues on the certain degree, masters and PhD level. And then now we move to the credentials, which is a part of the exploring topic we want to discuss today, which is I'm going to discuss in details about this because there are a lot of issues about this. So you have I put a pyramid here, it adapted from Kucher 1979. You have the top one is primary credential. The second is secondary credential and tertiary credential. So what is a primary credential? Before that, I try to recap again. Credential refers to the qualification, achievement, quality, or aspect of the person's background, especially when used to indicate their suitability for something, for work. For example, I give you an example here, a degree of social work. And primary credential are those earned over time by direct contact with the trained instructor. You have a close supervision when you do when we're talking about primary credential. Example, person-to-person supervisions and direct observation by senior colleagues. So this is what I mean by primary credential. Objective and subjective evaluation of the progress are made by multiple evaluators as the training progresses. Example of such credential include coursework, graduate training programs, supervised practical internships, and specialized postdoctoral training. This is also fall into the primary credential. So the outcome measures may include, if you want to say, the primary credential, it has to be a transcript of grade degree, like you did right now, is a primary credential. Certificate of completion, if you have to go for a certain training that require you to pay, sometimes the amount you pay, actually, you want to get to certify. So certification, they provide you a certification of completion. And the outcome measure for primary credentials, one of them is evaluative letter from supervisors of instructor. So you know that the person certified enough to do a certain job. So this is fall under primary credential. So secondary credential not only use primary credential, you have to have a primary credential as prerequisite, but also incorporate other element in determining qualification. So secondary means you have to have a primary credential, which is possibly you also doing the same thing here, doing enroll in this program. I don't know. And the example, like certain people are going to specialize on certain areas, so they have to take a statutory licensing and certification, as well as recognition by reputable specialized certification board. For example, Academy of Certified Social Workers, the National Board for Certified Counselor, or the American Board for Professional Psychology. I'm giving the example here from United States. And I'm sorry again, I not really go to the Malaysia just because I very much time to Google it. If you have question about that, I'm going to look up on this example in Malaysia situation. So secondary credential typically require payment of application fee followed by regular renewal charges. In the absence of detailed knowledge of the candidate's background and behavior over time, the grantor of secondary credential usually require approval or endorsement by click chosen by the candidate. So by now, I hope you can differentiate between primary and secondary credential. And then the red one is referring to the tertiary credential, which they base solely on the evidence that primary and secondary credential have been obtained. So this is maybe the highest level of credential that may be required by a certain people. And membership, for example, in certain professional organization. I hope you guys already, if you are very serious in this field, I hope you guys already signed up for a certain membership in the society in Malaysia, especially. Membership in certain professional organizations, such as APA divisions that require primary and secondary credential, state or local professional association, or listing in the National Register of Health Service Provider in Psychology. So this kind of a thing that require a lot of, maybe it take a longer time. So with this information I'm giving you, so with this course subject here, we try to lay out what is the ethical issues. How does it become ethical issues? So I'm giving you a scenario here. Try to create a scenario. Salma, which is not the real name, served as a field placement supervisor for the Central School of Professional Psychology, and Sash held the title of adjunct assistant professor at the school. So at the same time, he held the position of the supervisor and adjunct assistant professor. Her role consists of volunteering 2 hours per week of supervision. Sama was also listed in the National Register of Health Service Provider in Psychology by virtue of her degree, state license, and 2 years experience working in a healthcare setting, next to her diplomas and licenses in her waiting room. So he got the big waiting room possibly, and he put all the certificates and credential. So were framed copies of letter confirming her faculty status and a certificate of inclusion in the register. She also chose to list those credentials in the published announcement of her practice and her office letterhead. So where is the ethical issues here? Because she holds many positions, so one can fake the credentials. So this time I just giving straight the you're going to discuss it later, but I put out her behavior falls in the gray area, which is good to put that credential, but it falls into the gray area between unethical and acceptable in professional behavior. Why? Because she put everything on the wall, like she framed a copies of it. Copy means maybe she not put up the real one. Maybe then somebody can question about it. When somebody question about it, there must be ethical issues. Like for example, I give another issues of in academic, like if husband and wife work in the same department, and if somebody question about that, it's already the ethical issues involved. as long as somebody question about that, regardless of their in one paper they have two names in one paper, so people question about that. So there is a ethical issues. It's same into here. It falls into the gray area because we may not know whether the certification or credential issues is real or not. So another justification, I put it here, the uninformed member of general public has no idea what the register listing signifies and could misinterpret it as constituting some incremental credential or testimony to Dr. Sasma's competence. So it comes into the competence issues now, because she got a lot of the credentials where people question which one that she really good at. So at the last one, maybe depending on how she present this affiliation, because she hold many positions, sometimes she cannot show off all the credential that she had. So it depends in maybe it depends on how she present this affiliation. So this is how the ethical issue fall in the when we discuss about primary, secondary, and tertiary credentials. So how you clear with that example and case scenario. And then we already covered the definitions, we covered the training issues, we covered the credential issues, and now we move to the maintaining personal competence. We talk about Dr. Salma, that maybe it's the issues of the competency, because you got a lot of credential. Maybe some people question, are you really good at a certain thing? Because you have a lot of certificate that that surely give you the confidence to do the practice. But what about the competence? So right. The maintaining personal competence, I would like to put up one case study about GCN504 that have a SID conducted a cognitive evaluation of adult client using the third edition of the WASE. This is a test that we use for the cognitive evaluation. A full 4 years after revised form number 5 have been published. The question on this point, he noted they're about the same, and the new kit price, $1,200 is far too expensive. So there is a issues of using the cognitive evaluation, the outdated one, and then now they are using the latest one. So Gigi doesn't want to use it and make the excuse of say that the new kit or the new evaluation form is it's a bit too expensive. Is it ethical? Is it questionable about the ethical issues? Is it any ethical issues here? Maybe the WASE number 4 is much more reliable and updated to assess a certain cognitive evaluation. So maybe that's the issues here. So now we are questioning about the competence of Zizek, whether whether he actually competent enough, to evaluate the customer, the client. So I just put out the answers here that I can think of. The Dr. G is the same category as a college professor who has not bothered to update course notes in several years. So that's it. So I was, if he not able to or not willing to upgrade the test, and I'm sure that he not bothered to update the course note in several years as well. So Dr. Yip resistance suggests a more serious problem, blending ignorance with arrogance. So this is what I can be reflective to this case scenario. So this is one of the example, or maybe I'm going to put up in your exam questions the scenario like this, and I would like you to give your reflective what you think about the situation. So my subject is not really remembering things, it's about how you understand the concept of certain ethical issues and try to apply it to the situation. It's like more into kebat punya question lah, macam budak-budak sekarang kan yang buat UPSR. So you have to have some kebat punya thinking. So it's not really straightforward remember thing. Or even I give you more flexible when you're defining a certain terms, like for example, what is a primary credential or what is a secondary credential. You can do any of your understanding, any words, any sentence from your understanding, as long as you give the example, and that's it. All right. So I think the discussion on my part today is more into towards the end. And I'm going to introduce you a bit more into the impact practitioner. What I mean by impact practitioner? Impact terms is more into the broken, or impact means not function. So I put it like a burnout, which is common for us, even me or you guys that working at the same time. Burnout. So I put a scenario here. Srivanti worked as educational psychologist in a large urban public school system. She feel overworked. I put in a red color here, and unappreciated by client administrator who often made unreasonable demand on her time. Dr. Srivanti could not set limits on her work situation and began to dread going to work each day. She applied for and got a job in another part of the country and resigned her current position, giving less than adequate notice, leaving behind several uncompleted student evaluations. So I feel that she's burnout because she overworked and she unappreciated by the workers and co-workers and her administration. So she just left like that. So I consider this as a burnout situation, and this is an impact practitioner function as what we expected. So, what is a sign of the burnout? So apathy, chronic frustration, which is she has, a sense of depersonalization, depression, uncharacteristic angry outbursts, emotional and physical exhaustion, hostility, feeling of malaise, or aversion to a passion, reduced productivity. Of course, when you burn out, you reduce the productivity because you overwork, or lower effectiveness at work. And then we have to figure out what is the factor that can have from burnout. Is a role clarity, positive feedback, enhance what is the hacks that we can give to the burnout workers. So you can give a social support in the workplace, personal accomplishment, even a small one, just give away when it's due. So personal achievement, realistic criteria for client outcome, and accurate awareness of personal strengths and weaknesses, allowing the good sense of internal control. So now uh, we're going to do the activity for the class, which is this is the only mark that I will get gain from you guys. No assignment from me. So I would like you to follow this link. Maybe I just put it up in the chat. So this is from our last activity. Maybe I can just stop here. Stop sharing. So you can just click that. I put on your chat box. Excuse me. You can click on the Padlet link there. And then you need to give a response to the question that I'm giving you right now. So this is more into the pre-exam kind of class activity. For example, okay, let's look straight up, not digress anymore. Let's look straight up to the slide here. High quality professional practice demands two very different type of competency: intellectual competence and emotional competence. So I would like you to define intellectual and emotional competence with your own words. I'm giving you 2 marks here, 1 mark for intellectual competence and 1 mark for emotional competence. Go figure. And then remember that when I said to you, I give you liberty to give the definition of each in your own word. Make sure that you're giving me the example for each definition. So I want you to go to the link that I'm giving you in the Padlet here. So give away the example, your answers there. All right? Right. And then color them you know that last time we practiced with the color. So color them with the green background and put name on it, okay? If you have any problem, just voice out here or maybe put in the chat box. More than happy to entertain. I'm going to check this now on the Padlet whether you guys can stop sharing. Maybe I can just share the website. See the dashboard here. Yeah, they call it privacy confidentiality record keeping. This is we are using the same bot that we used last time. So use your own words. So this is just a practice for the exams. So my exam question is something like this. So something like I'm going to test you with your understanding, not your memory, because no, you know that I also don't have a good memory, so no point to test the memory to students. So rather than your own understanding on this, so define at your own understanding what is intellectual competence and emotionally competence, not intelligent quotes, not emotionally quotes, but intellectual competence or intelligent competence or emotionally competence. Then to color them, you have, when you click on your post, you have 3 dots there and you can color them with the green color. So I know that you're answering this. Make sure, because it's 2 marks, 2 marks means 1 mark for each, and each definition should come with the example. Yeah. I can see some people type in. So you remember that in exam you have 10 minutes for each question. So you have another set of questions right after this. So plan your time wisely. Otherwise, you get stuck in one question for long. Any definition have no wrong or right answer. So I hope that you understand the concept. That's all matters. Maybe we play some music while you write, while you typing it. What kind of music you listen? Let's do some. Let's see if we have classical music for winter. Because in Kelantan right now is a monsoon, so I normally try to be with monsoon, listen to very mellow songs. So can you listen to the song? Can you hear the song, the background song music? Can someone just give the nope?
No, doctor, can't hear.
Okay. Check. I give you another 3 minutes and can you guys listen to the music? No. Still no. Okay. That's fine. Don't bother about that. I just want to. Right. I can see some of you are struggling to give definitions. Yeah, we can have example here. A uni knowledge acquisition based on established fact and studies that applicable a certain field of study or population. Emotional to emotionally able to adapt the situation faced in daily life, related professional or personal setting. Anger management, conflict management. Okay, good job. Zingni, you don't define anything yet. Nisha, nope. Jimun, just typing. Fahima, you complete the intellectual competence, having the knowledge and cognitive ability that is required to perform certain skill. That's good enough to say that. What about Melissa? Intellectual competence is something measurable. Example, how did an individual perform in a cognitive test and how to apply to learn knowledges? Okay. Emotional competence is the ability to deal with emotions. It's harder to measure and subjective. Well, that's okay. It's very general, but the more you give the example, it's much more better. How individual deal with overtime work stress. All right. You can practice a bit more about that. See, Azmaru, intelligent competence is a person's ability on using whole knowledge. Oop, I lost. And cognitive skill in everyday life. Oh my gosh. It's moving. It's like very difficult to answer until everyone put on their answer. So I'm going to rate you later, but another 2 minutes, is it all right? Okay, another 2 minutes. Make sure you color the background with the green one. So I know that.
Excuse me, Doctor.
Yes.
Have I put up my answers yet? Because I'm not sure whether I sent it already or not.
Let me check. Have you seen this screen right now? Can you clearly see this? I think I read one of your answers. Yes, this is you.
Oh, okay.
Oops. It's moving because everyone keyed in the answers. So I think once everyone stopped keying the answers, I think I can spot. Yeah, you're here then. All right. Change
Okay.
the background to the green.
Okay, I forgot how to change
How
the
you do?
background.
So you hold over your mouse, and then you see this the 3 dot here,
Okay.
and then you can choose the green color here. So I know that this is the first part of the activity today.
Sorry, doctor. It's asking us to update, and then if update dia punya like the answers are running. If I want to
Say
change the
again.
background. Sorry, I wanted to change to green, doctor, but the page is asking us to update.
Yeah.
Yeah, and if I'm gonna update, then the answers will be like it will disappear.
Oh, really?
Yeah.
Did they disappear, or I think you just copy that before you update? You refresh that. Copy,
Okay.
like select all and copy and refresh that and put it back here.
Okay, thanks, doctor.
No problem. So, yeah. I can see some of you already put out the answers. All right, 1 more minute. When you give the definition, the best thing to do is to give example as well. So that's a complete definition for me. Even your definition just very general, then when you give an example, then it's complete on itself. Right? You have 30 seconds before we move to the next one. I'm going to cover more of the. Some of you email me whether we can do some more case scenario study, which is related to the your daily job or your application on the daily life, or maybe on related to your exam. We're going to do that during exploring professional issues. There is another session, 1 hour with me somewhere next 2 weeks or next week. I'm not sure, but we're going to cover that. The whole tutorial session, we're going to practice of answering how we're going to answer the exam question, as well as to understand a certain concept of these ethical issues, especially in this subject. All right. Ayman, can you change the background into green? Wani as well. Nisha. Kavish as well. Can you change it to the green? Noor Akhtar. Azmaru still not changing. Let me check if I can just change to yes. Shamina, I can help you to change it. No, that one is confidentiality last time. No, Akhtar. Kavish. Iman. All right, get ready for the next question. Right, it seems that everyone stopped typing, but I saw some Hongo still typing. That's fine. Jimon as well. The rest, change to Misha. I don't know who's wrote this. Not mention the name. Double check if you wrote your name there. Melissa, you put the name at the bottom. That's fine as long as you put the name. After. All right. This is a blue color. Ashkin.
How to change the color of the background?
Yeah, you hold over your mouse here. You see the 3 dots on your screen right now.
Yeah.
Click that and you click the green one here.
The 3 dots. Green one, the link to draw.
Not the link, on the screen. Can you see the screen at the moment?
Screen.
Yeah,
Yes,
I put
I
the
can.
three dot here. This is, for example, this is your post. You click 3 here and choose green.
Again, letter again.
All right, 3 dots. You
Yeah.
hold over any of the 3 dots here and then click green.
Okay, thank you.
All right, get ready for the next one. I think, can I just move on to the next one? All right. I share the chat. All right, so read the situation here. Swarna work as educational psychologist. So the same thing. I lay out the problem here. She feel overworked and appreciated. During the exam, maybe you can underline this, the important word that make you the hint to answer the question. So overworked and appreciated by clients and administrators who often make unreasonable demand on her time. Dr. Swana could not set limits on her work situation, began to drag going to work each day. She applied for and got a job in another part of the country and resigned her current position, giving less than adequate notice and leaving behind several uncompleted student evaluation. She was identified as impact professional because of burnout and affected her work professionally. So identify the warning sign of the burnout. So I want you to give, let's say this is a 4 marks. I want you to give more than 4, which is maybe 5. What is the warning sign of the burnout? So when you answer the question in the Padlet, just give A1, what is a warning sign? A2, what is another warning sign? A3, what is another warning sign? Just a simple one, because when I say identify, is identify, not what a long statement. No, not that one. Identify, maybe you just listing out what is a sign of the burnout, and B, what will you think factors that can help someone to get rid of the burnout in that scenario, which is 4 marks, giving 5 points there, just in case another one is not working, it not make sense. So in this situation, I want you to get practice how you're going to answer your exam question. And this is not the exam question, but this is one of the things that I'm going to ask you in the exam. You need to identify the situations, what is the situation is all about. And I want you to give your own opinion. What do you think about that? So go back to the Padlet and then answer that and change the background into the red color. So I know that the green one is the first question and the second one is a red color. So just answer that. Identify the warning sign of the burnout. What we just have at the lecture, if you understand it, what is the sign of the burnout? Just list out 4, and this is a 4, but I suggest you to give 5 because maybe one of the answer is not really make sense or very general. So and then the next question is, what will you think factors that can help someone to get rid of burnout in that scenario? Okay, I'm going head over to, or you want to read again before I close the sharing and go head over to the Chrome to see what's your answers on that. Maybe I just leave it here for 1 minute. I can just maybe I can just check it here. Remember, simple is the best. Less is more. Which is you help me to correct your answers as well, and I also help you to make a simple answers. But the simple answers is sometimes is a very difficult answer. So think carefully when you answer this, even in the exam as well. So, what is the warning sign of the burnout? And then, what would you think factors that can help someone to get rid of the burnout in that scenario? I can see a few are actually already answered that. Just with your own word, because you cannot remember things easily because you have a lot of subject to remember. Maybe some of the subject require memory, a good memory. So in this subject, you just need to understand the concept, and that's it. And if you think about yourself when you burn out, what the warning sign when you burn out? What is a warning says to the body? Warning sign to your body, whether you feel nervous, you feel anxious, do you feel sweating? That could be one of the answers, but think about the specific answers that we learned just now. So, right, I can see depression is one of them. A warning sign of the burnout. Overwork. Reluctant to work. Well done. Not being able to set limits, yes, probably one of the sign of the burnout. What about changes to the body? Somebody recall anything that I presented some just now? Um, and the best thing when you have the question, you need to go back to the question and maybe you can underline certain important keywords and giving you the hint. So that's one of the counter that you can get some clue like when you try to. Sometimes you black out uh, the how to answer that. So the best thing, take a deep breath and think about what happened if Swana is me. So what I see the changes in my body or what happened to me. I'm sure that some of you already sometimes burn out already. So you already know what the sign, the warning sign of the burnout. Armani, you put no limits to her work, giving inadequate notice. This is not the sign of the burnout. The sign of the burnout is see from Swana. It's not from the situation that I give it to you. So it more into the changes. We're going to see the answers right after this. So, but I want you to think about how you actually think about the situation. It seems very easy because you not have to remember things, but it's about the understanding of the concept. What is a burnout? How are we going to overcome the burnout? Fatigue is one of them. Good job, Shamina. It's happened to the body. Sometimes burnout you can see from the persons. It's showing off that signs. So the warning sign is coming out from that person. What do you see from the person? Is a lack of motivation. That's great. I see lack of the sleep. You can see that for some people, lack of the sleep is one of the sign of the burnout as well, but not very specific. But that's fine. That's why I asked you when I ask you like how many points that you have to give. Look up, go figure on the marks that given for each question. If the mark is 4, make sure that you give him more than 4. So one of them may be not working, so I can count the other answer as well. So make sure it's short and sweet when you answer that. Defensive is one of them. Good job. Yeah, I can see some of you are putting out the answers. Yeah. So we have another 2 minutes. We have another 2 minutes. I'm going. Yeah. I leave it to you to fill up. Make sure that you have at least five answer. So it's a good practice to do that for the exam as well. right. Who is the class rep for this subject? Is it Melissa?
Yes, Prof.
Melissa, is it everyone here today?
I think we are lacking of one. There should be 24 of us.
Okay. But in my attendance sheet is 23. Who I actually missed that?
I think some.
I think Ramesh did mention in the group that he is not attending today because he's at USM Penang.
I see. Or is it Ramesh say something in the group? I'm sorry.
Yeah, the WhatsApp group.
All right. Okay. So Ramesh is not today. That's the only one, is it? Only Ramesh. Yeah, I
Yes,
think
only
everyone-
Ramesh.
Only Ramesh. Okay, good. All right. So, okay. Back to this. You have another 1 minute and we wrap up the session. I can see some of you are. All right. Fahima, I change. How to change yours? No. Yeah, seemingly like everyone already put up the answers here. Ifa, you need more on the ways to overcome burnout. Shamina, you need some more time on the warning signs or maybe ways to overcome burnout. Zingni, still thinking. Tavish, you should be able, yep, can see that. Nisha, good. Mariam, Fahima, good. Esha, very good. Azmaro, good. After, good. Anis, good. Wow. Melissa, all right. Ayuni, all right. Ongo, all right. Chicken, yes. After, okay. Yimun. Maybe add another one, Yimun. You only gave 4. Maybe just thinking another one. Yingji, yes. Nisha, yes. Okay. Okay, seems that everyone got the answers. All right. Okay. Let's stop there. So we're going to look at the answers. So before I look at the answers, this is a reference for today's lecture. I think I used mostly on Kuchert book 2016. And this, right. Let's go to the, what is the emotional, intellectual competence? So intellectual competence refers to the acquisition of the knowledge. Any words that you can define this are based on empirical research and sounds clinical scholarship regarding practice with particular client population. So give the example of it. Every time you give the definition, it makes the definition is solid. Ability to assess, conceptualize, and plan appropriate treatment for particular client or problem. So what is the emotional competence? I'm going to read all your answers and give mark for that. Is no wrong or right answer on that. So emotionally competent refer to ability to emotionally contain. Maybe I should make it red there, and tolerate the clinical material that emerge in the treatment. And then the example, capacity to self-care. And that's the emotional competence. And that's the only two. So if you got the solid definition, I give you full mark, 1 mark. If you only give definition without the example, I won't give you full mark. I give you maybe half of that. Is it half? Yeah. So something like that. So that's the one that I'm looking for. And we go back to the other scenario that we are discussing today.
Doctor,
Yes.
Doctor, just want to ask about the example of emotional competence.
Mhm.
If we just give the general example, is it okay?
Yes.
For example, the example says, the workers able to manage the emotional conflict at workplace. So is that the sample of example?
Yes, can, as long as it
Okay.
fall under the emotional what's that, competence. Yes.
Emotional
So
competence.
as long
Okay,
as
thank you.
I can understand that, so that's fine. Is it all right,
Okay, thank
Shaliza?
you, Doctor.
Okay.
Yeah,
So
yeah.
all right.
Okay, Doctor.
So the warning sign or the burnout, this is the warning sign. I'm going to check whether you fall into apathy, chronic frustration, or maybe deeply frustrated with the situation, depression, uncharacteristic angry outbursts, emotional, physical exhaustion, hostility, feeling of malice or aversion to a patient. So this is the warning sign of that person. We're talking about Swana at the moment. So Swana is a educational psychology. So we want to focus on her. So maybe you can put on the patient at the back as well, the answers. So apathy, something like this. This is a warning sign of the burnout. We have a lot of warning sign of the burnout. Just I only want you to identify only 4. And then if you give 5, I'm only to choose 4, the best answer. Right? And then what is a factor that can help from burnout? So maybe because when we do a lot of work, sometimes the work are redundant. So we have to roll clarity between another educational psychologist as well. So maybe you want to give a positive feedback to that person, which is even he overwork, then if you give a positive feedback, that will help. And maybe enhance sense of autonomy at work, opportunity for rehab from stress at work, social support or personal accomplishment, even small, something like that. So this is a thing that is coming up from your own opinion. It's not necessarily this one, but this something like this situation is going to be tested in your exam. All right, so I think that's it for today. And to wrap this up, so we cover a few definitions today. What is a definition that we cover today? Can I ask Azmaro? Azmaro, can you speak up? What is the definition that you learned today?
Yes, Doctor.
Yeah, what the definition that you learned today? Just mention any two of definition or term that you learned from today's class.
So we were discussing and talking about emotional competence, intelligent competence.
Perfect. So that's it. So Anis, Shafika, did you learn any new term today? Okay. Perfect. Okay, great. So Ayman, did you learn a new term today from this class?
Yes, I learned something about credential, that there are three types.
Credential, perfect.
Mm.
Credential and
The three types of credentials.
three type of credential, great. So it seems that you guys pick up the good term, and this term actually it makes easy for you to recall which lectures or which subject that you learn. So it is good thing too. Like for example, if you, because in exams they don't specifically tell you which lecture is that. So if you can recall the term that you learn from the each subject, you know that, oh, this answer must fall into this question. So this is a good. When I ask you what the term that you learn from this, you say the credential, you say about intellectual, you say about emotional competence and burnout. So this is the one that the lecture from professional training and certificates. So we're discussing about the burnout, what the sign of the burnout, what the factors that can happen from the burnout. So all right, we also learn about training issues. I need Kavisha. What do you learn something about training issues today? Give a few words. It's nothing wrong or right to answer these questions. Did you learn something new about training issues?
Yes, maintaining personal competence and the impaired practitioner. Under this.
Say again, the training issues.
Maintaining
Remember the
personal
training issues? We
competence.
have the diagram. We have the mind mapping, right?
Under maintaining personal competence.